Cedar Key is different. People say it's like the Keys used to be. And we showed up here. I pulled up in the first RV spot. I knew instantly. I said to my mom, this is it. So 3 nights later, it was a handshake right here with the old owner. It wasn't even for sale at the time. We're low-key hideaway, or not as low-key as we used to be. It's hard to find the vibe like this here, and everybody's super friendly. I was in my living room, and I started getting a stomach ache, and I didn't really think much of it. It started getting worse, and so after trying to wait it out, it was home for about 4 or 5 hours, and it started getting worse and worse, and I finally got up and off the floor and looked in the mirror, and my stomach, I looked like I was 9 months pregnant, and that's when I panicked. So we raced out of here and raced to the first hospital where they did a surgery on me. They cut out some of my small intestines. There was a blockage. So I was just backing up. But after about 3 or 4 days, my stomach was infected. I had a hole in my stomach, a huge hole. They kept pulling staples out, and it was bad. It smelled like a sewer. I'm like, this is not good. After about 4 days, I called my friend Mel, who was a paramedic, and I was describing what was going on. As soon as I told him it smelled like a sewer, he's like, you need to get out of there right now.
The thing that really caught my attention is what he was smelling. It was more than likely he had become septic. He had a severe infection in his abdomen, and at that time, I really felt like that his life was in danger. I had made a phone call, actually a text message to Dr. Ang about potentially accepting Scott.
From what Mel was explaining, it sounded like Scott had sepsis, so he needed care pretty promptly.
He arrived to the emergency room. You could smell the infection. It was a severe infection. He definitely had sepsis, and he needed urgent care. Sepsis, it's an overwhelming infection to where your body cannot compensate anymore. The bacteria is so overwhelming that your body starts to shut down.
They rushed me into surgery, and I ended up having 3 surgeries before I was ready to go home.
When you have someone that's sick, it takes a lot of different hands in order to make him better. And I think that's really what we offer here in HCA Florida Ocala Hospital, is that high level of acute care surgery and critical care. So we don't just do trauma, we do 4 things. We do the emergency general surgery, we do trauma, we do critical care, and then we do surgical rescue. And in Scott's case, he got both the emergency general surgery and the surgical rescue.
And we were at the hospital, and Carrie's mom called and said she had a dream that we got married at the hospital. And we were laughing about it. And somebody else said something. I looked at her, I said, let's do it. Let's get married at the hospital. Let's just do it right here while we're here. She's like, what? Let's just get married in the hospital. She's like, all right, let's do it. So we ended up getting married in the ICU, which was fun. I planned it overnight. I had a friend, Mel. He went online and became an ordained minister.
I said, but I guess I can try to figure this out in a short time. In the ICU, I married them, and it was a kind of an incredible honor, very unexpected. We now officially have your first official marriage.
The hospital's great. They brought flowers. One of the nurses had a wedding cake for us, and it was cool. It's a great story. So now we're married. Thank God I did. I got in that surgery, and it was like a miracle. The doctor said my fascia was kind of come back together, and they were able to sew it back together. And I would still have an open wound, but a month later, it's all but closed right now.
To being alive, Cedar Key. Cheers.
Yeah, it really was life-changing for me. I just feel healthier. I feel better. So coming back to the island and slowing things down and getting back on my airboat and going out to islands with my wife, that's what living here is all about. Matter of fact, if I ever get sick or have a problem again anywhere in the United States, I'm flying straight to you guys because I just trust you. The hospital you're at can mean whether you live or die.
One of the best parts about this job is watching people recover and live a normal life. Wherever you come from, whatever you do, we show up and we'll be there to take care of you.